Good afternoon, everyone. Mine is a study on outcomes of botulinum toxin injection to lacrimal gland for the treatment of epiphora. As we all know, epiphora is due to the disruption of balance between tear production and drainage, and it affects the quality of life by causing blurred vision, irritation of eye and periocular tissue, and also social embarrassment. Watering can be either due to oversecretion or impaired drainage. Depending on the cause of epiphora, the treatment can be either medical or surgical. Some issues associated with surgery are suboptimal outcome in certain surgical procedures, patients unwilling for surgery, and in elderly patients with comorbidities and contraindications. Botulinum toxin is a neurotoxin obtained from Clostridium botulinum. When it is injected to the lacrimal gland, it blocks presynaptic release of acetylcholine into neuromuscular end plates and decrease the tear production. There are studies which have shown improvement in watering due to various causes. Aim of the study is to evaluate the outcomes of botulinum toxin injection to the lacrimal gland in patients with symptomatic epiphora. Objectives are to find out the etiology of symptomatic epiphora, to find the duration and effect of the botulinum toxin, and to analyze the adverse effects of injection. It was a prospective observational study from January 2019 to May 2019. All the patients who cannot cooperate for evaluation or failed to follow up were excluded from the study. After a detailed history and ophthalmological evaluation, syringing and probing were done to find out the exact position of block. Schirmer's test 1 and Monk scoring were done before botulinum toxin injection. Monk grading is grade 0 is no epiphora to grade 4, that is epiphora requiring dabbing more than 10 times daily or constant tearing. Purified botulinum injection 5 units is given to the lacrimal gland under topical anesthesia transconjunctivally. After the procedure, patient was put on tobramycin eye drops and artificial tear drops. Patients were seen after 2 weeks and 1 month. There was a subjective grading of epiphora and also Monk scoring and Schirmer's test. Complications like ptosis, diplopia, hematoma, and dryness were looked for. Subjective grading is grade 1, 0 to 25% reduction in symptoms, to grade 4, 75 to 100% reduction. Statistical analysis was done using SPSS software. Pre and post injection values were compared using paired t-test. P-value significant was set as less than 0.05. Results are, we had 14 eyes of 12 patients, 9 males and 3 females. Mean age was 62.81. Etiology, canalicular block was seen in 78.57%, punctal stenosis 14.28%, and oversecretion in 7.14%. There was a statistically significant reduction in Schirmer's test before injection and after injection as well. In Monk scoring, there was a statistically significant reduction before injection and after injection. Subjective grading, 78.5% of patients reported partial or complete recovery from epiphora. Complications were, 1 patient had ptosis and 2 patients with dry eye. We had a statistically significant reduction in Monk scoring and Schirmer's test starting at first follow-up and maintained after 1 month. Subjective response, 78.5% reported partial or complete recovery, among which 50% of patients, that is 7 eyes, reported 50% recovery. When we compared our study to other studies, the cause for epiphora is variable. In our study it was 78.5, in other studies 55% and 58.6%. Percentage of improvement was comparable. In our patient it was 78.5. By the study done by Sia Hussaini, it was 90% and Vojno 74%. Dose of injection, during our study period we have given only single dose, that is 5 units. In other studies it was 2.5 units and they repeated as per the response. Complications, we had dry eye in 2 and ptosis in 1. Other reported complications are diplopia, bruising over the injection site, ptosis, etc. And we had 2 eyes who had prior DCR surgery and 2 had punctoplasty, but they had recurrence of epiphora and they were not ready for a second surgical attempt. All these patients were happy after taking botulinum injection. Reported complications are transient and they were ptosis, hematoma and diplopia. Out of 3 eyes failed to improve, 2 had a history of prior Botox injection. To conclude, botulinum toxin injection to the lacrimal gland is effective to control epiphora in selected cases. Degree of patient satisfaction is high. We recommend long-term studies to find out the duration of the effect and complications.
What is the usual dose? Dose is here you have
Hello.
given 5
Hello.
minutes.
Yeah, 0.2 ml we have given, sir. It ranges from 2.5 to, there is no consistency about, different authors are giving different doses depending upon their response, patient response.
Yeah. How?
Any danger of dry eye?
2 patients we had. 2 patients we had dry eye, but as we know it is a temporary procedure and we can put
What was the longest follow-up?
Actually, during the study period, I had at the time of submission of the abstract, only 1 month follow-up I had. Later I followed up.
So you did the study at the while submitting the abstract and did the study later on.
I followed up the
No,
patients after that.
That is not
So
permitted actually.
that is not
And
included in
even
the
if
study.
you did, you should not utter this here.
Actually, I am not included that in the study,
No,
in this study,
So
because
what is
you
the
asked
longest follow-up? Later on, did you do no?
3 months, up to 3 months.
So how long the effect lasts?
Up to 3 months, we had 64 patients
No,
per percentage of
Up to
eyes.
how long the effect lasts? When will you give second dose?
Second
if
dose
required?
we did after 2 patients we did after 1 month.
No, आपका study is not reliable. It lasts at least 6 months. It lasts 6 months.
No, sir.
We have done in patients and gave injection in January and patient came after 6 months, then again gave, and 6 months we have seen definitely lasts. Patient is totally asymptomatic for 6 months.
If not 6 months, at least 4 months to 6 months.
Okay, sir.